be some more techniques. Okay, so what we're going to do first is a spaceship. And your spaceship is your chair. And you have to make sure that you're comfortable. And I would suggest that that you practice it and not take notes unless you want to take notes, because you can always go back and listen to it. So you can actually experience it. It's really a very, very good technique. It's got a little Tibetan Buddhist psychology and psychoneuroimmunology and other kinds of things that are really very helpful. And some, of course, biocognition. Okay, the first thing we do is that we close our eyes in a comfortable place where we are. And when we close our eyes, we make two commitments. The first commitment is that you're going inward into your private world. You're no longer looking at your visual world, but now you're going into the inner world to see what's going on inside you. And there's a lot going on inside you. You are the universe, and see what the universe is. And the second commitment, which is a little bit more difficult for some people, is that you're worth the time that you're taking. And people that live in what I call the urgent present have a real hard time getting into that. So right now, you're worth the time that you're taking for yourself. So what is the mind-body code for relaxing? Very simple. It's the innate intelligence. It's not you. And what you do is you become aware of how your feet are touching the ground. And that sends a signal to the brain that there's firmness here. There's a again, perceptual history of firmness. We got perceptual history of firmness, and the brain knows what to do with that. And then second, you go to the part of your body that's holding you on that chair or couch or whatever, and you pay attention to how it's touching you and how it's supporting you. That's another indicator that says, I'm being held by something. I don't have to use my musculature to hold me. And the sense that it sends to the brain is, I'm being held. And it'll bring back all kinds of memories when you're being held, when you were loved as a child. All of that culture history is there. So we're going to the innate intelligence, to the what's called procedural learning type of thing, rather than intellect. And when you do that, you're triggering the famous relaxation response automatically. So you don't have to do anything else. Now we go to the next stage, which is contemplation. If we have relaxation alone, it's not going to be enough. So you have to have contemplation. And contemplation means that you observe what's going on inside you without any judgment, without biting the hook of the thought. The thought is a cloud. You contextualize it as a cloud passing, but you don't tell it to pass. You watch it pass. You have perceptual history of a cloud, and what does a cloud do? It passes. And it's very fluffy, it's very light, it passes. And you go back to that place that you can call the gap, you can call it emptiness, you can call it nothingness, the quiet place, the stillness, whatever you want to call it. It's an in-between thought. The more you let go of the clouds and you let them pass, the more you stay in that place. And that triggers the contemplative consciousness that gradually begins to grow, just like the relaxation response is growing. And one way to help the relaxation response in a conscious way is to drop your shoulders, unclench your teeth, and let your eyelids drop very softly over your eyes. So now you have relaxation beginning, contemplation beginning. And even if thoughts come in, it's okay. The relaxation response is starting, the contemplative response is starting to. Now we go to the cohesiveness. And the cohesiveness is actually the heart breathing. And you're doing heart breathing, imagining that the air is coming in through your heart and going out through your heart. But we're going to add a little component here. When you do that for a few minutes, you can show that you're getting coherence between brain waves and the heart rate variability, which is in between the heartbeats. But what you're doing now is when you inhale from your heart, imagine that the air is going all the way up to your head, to the crown of your head, and it's cleaning out everything that's out there that doesn't need to be, and it goes out your heart. When you inhale the next one, it goes in your heart and all the way down to your toes, to the firmness of your toes, and it comes back up and goes down, out through your heart. So it goes up, part of your body up, goes out through your heart, then in, part of your body down, back from your heart, it goes out. So do that for a bit, and then we'll go to the next step, just so you can get that cohesiveness. Even if you don't get all of it, it'll be there. You're preparing yourself. And if intruding thoughts come in, you just keep going back to the heart. The heart is the place that you're actually doing like a mudra, like a place that you can actually see. Goes in, goes out. So now you're getting relaxation, you're getting contemplation, and you're getting cohesiveness, which is the next step. And on your own, you can do this a lot longer. We'll just do it briefly so you can learn how to do it and then become proficient at it as you practice it. Okay, so now we can go into the new stage that you're preparing, the new play that you're going to be showing Broadway. You're the director, you create the scripts, and you designate the characters. And in that play, you are doing something in the future. You're 6 months in the future. 6 months, a year, whatever you want it to be, whatever makes sense to you. And in that future, you no longer have that particular limitation that you had. It's preparing the system to accept a new bioinformational field that doesn't exist yet. It is an as-if perception, but your biology will follow that as-if perception eventually as you train it. Your neural maps will go there as you train it. So this is a training process. And then you begin to see in your new play, what are your new scripts? You no longer have to say, I have this problem, I have that problem, I can't do this, I can't do that. See yourself doing it. And a part of you is going to fight it. The part of you that fights it, go to your body and see where it's being embodied, breathe into it, and let it go. It's a cloud, and you let it go. And you go back, and you start practicing the new script. You know that when people are practicing a script, the actors and actresses, they don't know it well. They have to practice it till they know it by heart. You're doing the same thing here, literally by heart. So you practice that, and then now that you're convinced, there's a part of you that's convinced, okay, this is working, I'm in the future now. Now, who are the old people in the script that are sneaking in and beginning to remind you of what you were? And you say now, if it's pain, oh, I don't have any more pain, I'm fine. I can walk better, I can, well, wait a minute, you got to be careful, because if you're not careful, that kind of, and you stop and you get him out of the play. Get out, you're out. Get him out of the play. You're not here anymore. And you tell security, don't let this person in again. Get him out. And then you bring a new character, whoever you want, that says, I'm so glad to see how you're doing. And they don't talk about the chronic pain or whatever. I'm so glad to see how you're doing, the way you're playing tennis, not the old script. Or I'm so glad now that you're skiing again. This is great. I'm so glad to see that. No reference to the limitation. And embody that. See how that feels. You have to embody it to see how the body is accepting that. And if there's objection, that's okay. You breathe into it, and you embody the new you, the new script. Then you begin to ask yourself, now that I have this accomplishment, what is it that I would like to do that maybe I don't feel as worthy? What is it that I would like to do that I would like to go around the world, or whatever it is that I may not feel worthy? Although intellectually I feel worthy, now when I look into it at experiential level, I don't feel worthy because maybe my parents weren't able to do it, or the people that I love weren't able to do it. And I can do it and they can't. So what am I going to do? That kind of thing. And then where the new script is, I am going to do this to show the world the potential they have to live in abundance. And you keep doing the embodiment. You enhance it as much as you want to. And then when we come back from the future, I'm going to show you some other ways to enhance it and to understand when you do it again. We'll do it again at the next session also, how to do it better. So what I'm going to do is I'm going to count from 1 to 5. You're going to bring it back from the future to the present, but with the new scripts and the new play. At the end of the count of 1 to 5, When you open your eyes slowly, look around and find novelty in the room, something that you haven't noticed before, and that'll get you into immediate mindfulness. Mindfulness equals novelty. When you see something novel, like a little something on the wall or something on the floor or something you hadn't noticed before, immediately you're into mindfulness. And that's a good way to come out of a deep state of contemplativeness. Okay, so 1, 2, 3, 4, 5. Slowly, when you're ready, open your eyes and find novelty around you. Oh, I hadn't noticed that book there. I hadn't noticed that the spot on the wall and whatever. Immediately you go into mindfulness and you back in. Okay, any reactions from anybody, any questions? Because that's when we really begin to refine it. And then I'll show you some other ways to make it even better when we do it next time. You can share the experience without necessarily saying anything that you don't want to talk about that's private, but the experiences that you had, both positive and negative, whatever it was.
So, the it I did, as you know, I have. Hello, can you hear me?
Yes, yes, go ahead. Can
Right.
everybody hear?
Yeah, I can hear you.
Okay,
So,
go ahead.
as I was going into the stage, like the deeper stage it went, or upper stage, I had more and more vertigo, and then it gradually um, disappeared. But at the beginning, it kind of escalated. Then it disappeared. Like, do you have any? Is that? I'm assuming it's the disturbance that came. My
Yeah.
brain does not like it. Do you have any recommendation or how to improve on it, or just a way of
It
processing?
disappeared when you came back, or how did it?
It's better now, but it was.
Okay. Can I just say yes or no, so don't worry about it. Can I mention something about your vertigo? Do I have your permission? If not, I won't.
That's fine.
Is it
That's
okay? All right. We've been working with vertigo. And one of the things that we've been doing is creating a space, number one, a new attribution for the vertigo. The vertigo is a kaleidoscope, and you sit back and you enjoy it, number one. And number two, so the attribution is extremely important. The attribution in psychology is really important. The name of the cost that you give to something. So this is vertigo, oh, this got something really bad, or this is a kaleidoscope that I'm going to sit back and enjoy, number one. And number two, Son has been doing what I call the Zen walk, or it's called the Zen walk, and the brain becomes very aware when you're out of step. That's when proprioceptive learning occurs. When you're riding a bike, you're not saying, okay, how do I do it? Proprioceptive learning is doing it without you having to do anything. So in the Zen walk, what you do is you do very small walk, very small steps. You lift your leg slowly till you get out of balance. And when you get out of balance, you pay attention to the vertigo. And you tell yourself, oh, I'm getting better at balance. Attribution, and the brain is picking up the information. The brain is saying there's movement here, and this is out of balance. Whoops, this is important. And you've been able to reduce the vertigo significantly, right, son?
That's correct.
With something that couldn't be done before. Now you can use it for anything. The Zen walk, which I'll show you at another time more specifically, you do the movement very slowly, and once you learn how to do it really well, do it slower so you're always a little bit out of balance. The movement has to be very slow, and when you're out of balance, you bring in the attribution that you want. Okay, chronic pain is gone. Chronic pain is gone. Whatever it is that you're working on, you're putting new information into the brain neuropsychologically. You're putting new information that says to the brain, this is significant. I need to pay attention to this. So we've done it with vertigo, with many other things, and so yeah. So what I do is keep doing the play, and sometimes what happens when you do the play, it's so scary that there are no neural maps for it. And well, wait a minute, what's going on? I don't believe this, or whatever. And some of the symptoms will come right back. But then you play it out and you do this. Okay, any other questions? Because I'm going to refine this now that we've done it. Anybody comments?
Yeah, I had a question.
Yes,
When you did the the coherence, the heart coherence,
yes.
and now that was very interesting to me because I've only done that with the sensor of the the people who run heart math,
Oh, the heart math people, yeah.
the heart math people. But I loved your approach, which is breathing in through the heart, up to the brain, back out the heart, breathing in through the heart, down to the feet, back out the heart. Have you tested that to with their equipment to see if that gives you the coherence, the beat to beat variability?
No, no, but that's a great question. We're gonna do it with these people, Payron. They do a lot of epigenetic work, and Dan Stickler. We're gonna do it with that. And they have a sound chamber where they
Yep.
can create theta waves very quickly. So we're gonna do that. We're gonna check that out. And they got me into the chamber, and it was wonderful. I was supposed to get a little psychotic, and I was so relaxed
Okay.
because you practice it. But yeah, no, that needs to be done, because I think that it'll be a lot faster. And also, what I'm doing is I'm kind of modifying a Tibetan technique where the Tibetans will breathe through the nose, and you're getting white smoke in and black smoke out to get out of the what they call the negative imprints of disturbing behaviors or
Right.
disturbing thoughts. But it'll also, as you know, it'll also affect all kinds of negativities that are going on. So yeah, that's something that we're going to be doing.
Well,
But yeah, that
I
technique,
want to say
I added that to the heart math reading, so to bring
that's
some
good because I have never been able to do it with the heart math stuff.
it's
Because
very difficult.
what happens with the heart math stuff is you put the sensor on, and then you have these little games where you get the balloons over the fence with the by how relaxed you are. But what happens to me over and over when I do that program, the performance anxiety of getting the damn balloon over the fence or whatever it
That's
is
right.
you're doing literally removes all the cardiac coherence.
Absolutely, and you're right. And I think that one of the problems with that is that you're using classical biofeedback,
Yes.
but there's an internal autogenic biofeedback that you can use within your own. You're
Yes,
not
like
doing
that.
performance, and that will bring it in faster, I think,
Yeah,
because you're absolutely. I would have a lot of performance anxiety doing it.
I did. Yeah, and I
So
tried it over and over, got the software, the whole thing. But what
yeah,
I did just now with yours was so innate. It was like so innate that I wasn't being judged. There wasn't an external, when you have done as much testing as
yes,
you and I have done through life. I mean, that's just ingrained. I have to perform and get this right. And then you're
absolutely.
out of it. You're absolutely out of it every time
So
you're there.
try it with that, and you'll see that it's going to be. Do you have the equipment?
Somewhere.
Okay, yeah. I would do it, and you'll see how beautiful it's going to be, because there's no performance anymore. You're going into your internal
Yeah,
processes and
yeah.
allowing them to happen. I couldn't do hard math either, and with this, it's just really powerful because I
Okay.
have that performance. And also the competitiveness. Oh yeah, I can do it, and it just takes you out neuropsychologically. It takes you out of the objective.
It does. Okay, beautiful. Thank you. Thank you.
I'm glad you brought that up, Chris. That's really good, because that's important.
Okay.
Yes. Anybody else? This is the time to do it. It's your time.
To me, I felt like the area that I felt clear was in my throat and then near like the sacral chakra. Like
Okay.
the benign boundaries, the test that we just did, like that makes sense to me.
Yeah, yeah, yeah.
Um,
It's very compatible, because we can learn a lot from Tibetan Buddhism, but we can certainly they can learn a hell of a lot from Western science too. And the Dalai Lama is very open to that. So that's what I'm doing. I'm bringing both together. But any other questions before I expand on this, or comments? This is a powerful tool. If you do it, you'll see, whether you do it in the future present or not, you'll see that it has a tremendous effect on getting into innate intelligence, because that's really my thing now. Innate intelligence and movement with context are really important for me. Okay, here's what you can do to enhance it. We have two variables that stop us from reaching our becomingness. Our becomingness is what Carl Jung called individuating, becoming who you are, all those kind of things that get you beyond the pale. There are two reasons that stop you. Now that you know that there's a culture editor, the culture editors teach you by observation. So let's give concrete examples here. Your mother is a procrastinator, and she says to you, don't ever be like me. No, Mom, I promise I won't. And intellectually, I'm not going to be a procrastinator, and you become a CEO of a big company and you start procrastinating. What's going on here? I don't want to be like my mother. What's going on? Number one is that if you're trying to not do what your culture editor was doing, you're besting at a deep bioinformational level, you're besting the ideal, the culture editor who is invincible. You're besting the culture editor. And in order to not best the culture editor, you sabotage. Totally subconscious. That's the first one. The second one, let's say that your mother is very punctual and she says, I want you to be punctual. And you say, hey, that's good. I'm going to be like my mother. At the deep bioinformational level, you don't want to imitate your mother. You want to do it your own way, even if it's procrastination. Because one is, I don't want to imitate, and the other one's, I don't want to best. They both have to do with the becomingness. So when we do it next time, you look at it and you can practice it on, you can say, okay, what am I doing? Am I besting? And I'll give you an example. I was working with this CEO from a big company in Poland, and successful woman. She had but she was always late, and she worked behavior modification and nothing worked. So what we did was, okay, the technique, and she determined that after she learned the dynamics, she determined that if she was going to be punctual, she was, and by the way, the archetypal wound that you keep, like her mother was shaming to her, the archetypal wound that you keep is what you use when you think you're besting your mother. So in her case, she thought, after she learned the method, if I best my mother, I will be shaming her. So therefore, I will not do that. So we did a technique that we'll do next time to show you how to deal with that. And when she did it, again, because you're the director of the play, it's not what's happening out there, it's what you interpret that's happening out there. I've worked with twins that have been sexually abused by their father. One saw it as shame and the other one saw it as betrayal. So it's very, very unique, your bioinformational field. So once she learned the technique, she started crying. And she got it at the bioinformational level, at the embodiment level. I contacted her later and she said that she was 90% on time after that. And when she wasn't on time, I said, that's great, because you don't want to be perfect. Imperfection is really exciting. Perfection is boring. It's okay. 10%, be late. Give yourself permission. But you see, it's that powerful because it's deceptively simple, but you're getting all kinds of neuropsychology in there and all kinds of things that are working for you that actually make the changes. And this is why it doesn't matter how much intellect you have, how much intellect you put into it. There are other processes that are going on that are really very important. So you can start practicing, okay, now, if I do better, or if I imitate the goodness of my culture editors, could be teachers or whatever, what would I be doing? Would I be besting them? Or am I being a rebel with the wrong cause? And I don't want to be like that. I want to be by myself, on my own. I want to individuate. And there'll be techniques that I'll show you how to do next time. So we'll do that. So what I want to do is stop for a few minutes and see if you have any questions, if you want me to expand on anything, and then I'll continue to go with a little bit more of the future present. Because it's really important for you to, if you have questions or comments, they're usually extremely important because you're going to clarify for yourself, but for other people that maybe didn't even think about it and thought, oh, that's a good idea, I hadn't thought about that. And the more difficult, the better. So what do you think?
I wanted to know about breathing, and why is it that the breathing is what activates the innate state. Um, I mean, because sometimes it's hard for me to breathe. And so, I mean, it does really make me have to slow down. I was just wondering if you could help me understand why that particular portion is what makes it.
Well, one of the problems with breathing is that the moment that you become aware of your breathing, it becomes difficult because, oh my God, am I breathing fast or slow? So you sometimes have even shortness of breath because of that. But these people at HeartMath have done a lot of work with biofeedback, and they've measured a lot of the what they call the heart rate variability, and they've also looked at brain waves, and they found that that is a technique because you're not really breathing from your heart. You are here's another as if quality here. This is an as if, it's not really happening, but yet some physiology is going on there that's saying, going from here. Chris, maybe you might want to say something about the physiology of it, or beyond that, or are we okay with?
There you
Um,
go.
you got me unmuted?
Yes, you're unmuted.
Yeah, we can hear you now. Okay.
What the breathing does is the vagus nerve runs through the diaphragm. And when you breathe slowly in through your nose, you're activating the entire parasympathetic rest and restore or rest and digest system. And you're digesting stress hormones, cortisol and epinephrine. So breathing in through the nose, out through the nose, automatically puts you in a receptive state and also entrains that beat to beat variability of cardiac coherence. So it's like having this perfect balance between the gas and the brake. And when you exercise, by the way, John Douillard in Denver teaches people how to exercise, even had people climb Everest with no oxygen, by nose breathing in through the nose, out through the nose. And if you never go beyond how the exertion beyond which you can't, when you overexert yourself and you're breathing through your mouth, that's a stress response, and it will automatically create oxidative stress in the body and cellular inflammation. But when you breathe only through your nose and you do the level of activity in which you can maintain that, you find over time, you literally will expand your ability to use oxygen well. It's very, and of course, obviously, there's all the contemplative practices, right, of pranayama and all the breathing. And I was doing a yoga class once with Rodney Yee, and he said, make friends with your breath. It will be the last thing you do.
That's pretty good.
Like, I did want to ask you, I have a question. So Ron has had some surgeries that have not gone the way we wanted them to at all. So when he was doing the future present, the future was that he can walk unassisted. So then, when we came back from that, we got up to take a walk, and he says, but I can't walk. So how do you gradually, the attribution needs to change there?
Yes.
Yeah.
That's a great question. And what you do with that first is you practice it many times so you can get that proprioceptive sense without actually being able to do it. And then gradually you can say, okay, now I'm going to the future present where before you were holding me this way, now you're holding me this way. So desensitizing gradually from most to least. So he can walk with you, you helping him, but with a little bit less of help than you did last time. And then proprioceptively, by the movement and by the actual attribution that you're giving, you begin to train yourself at the innate intelligence. And we don't know exactly how that works. Just like we don't know how you learn a bike, you know with the bike you have proprioceptive learning, you have proprioceptive memory, but nobody knows why you eat a carrot and it turns into Dr. Northrup. You don't know.
Right.
You know the biochemistry and everything, but you don't know the bioinformational intelligence that's going on there. So with the movement, I think it gets to that innate. And then he could see himself with you, helping him less and less, so that when you actually do it, it's reflecting what he learned.
Okay, so doing that in that, when we've done the contemplative thing and then we go into the coherence, so you're practicing that, sitting down, obviously,
Yes,
and seeing himself using my assistance less and less,
that's right.
and just practicing that every time.
That's right.
Yeah, okay.
And you'll see that, I mean, it's going to work. You'll see it. It's going to work. But that's a great question you bring up, because sometimes, like in the case of his movement,
Right.
Chronic pain, you can do it. But if you can't move, you can't move. So that what you do is you practice it and you gradually see having help, but reducing it so you can desensitize yourself to that. And then also have him imagine that he's doing it in a new context, because the old context, he is not able to do certain things. In a new context, he's able to do. So you're getting perceptive new archives, and then you can do it. So that's a great question, and keep me in tune with that, because I think it's going to work. I mean,
Yeah.
I've seen it work with really, really difficult situations.
Okay, great.
But you're right. You have to have a replication of what you did in the future for you to have the belief system of the attribution. Otherwise,
Yeah.
no, yeah, well, I did it and I can't do it now. So what you do is you do gradient. So that's
Okay.
a great question. See how important these questions are. It really helps us refine the system. So that's great.
Yeah.
Uh,
Okay.
and the other thing for physicians, you know how difficult that is. Physicians have a course, and in that course, the biology follows the course of what it says. You can't walk with this and that, and you want to break away from that. And no, there's no course here. That this is the average, and I'm going to break away from the average because I'm an outlier. The worst students are health professionals, because we have a belief. I had such a hard time unlearning the neuropsychology that I learned of the pathology of the brain before I could actually do it with other people, because no, that's not possible. I mean, I was told, look, after a year, forget it. That's it. Any rehabilitation is gone. There's nothing more you can do. And I worked with a woman for 3 years, and all the 3 years, she continued to grow and grow and grow, because those are the tunnel vision that we create.
One of the greatest quotes of yours that I love is, gerontology is the study of the pathology of aging.
That's right.
But then, so what you're taught is, after this age, this is what happens. And after that age, I can show you my textbooks that show what happens to the female human body over time. And I remember being a med student thinking, this can't be true.
Yeah. You were an outlier, like George Solomon said. No, that's not true. It doesn't, just because you have the rheumatoid factor doesn't mean you're going to, and everybody thought it was crazy, but that's what he learned.
Yeah.
When he went to school, he said that when he was learning immunology, T cells are immune cells of unknown function. so but yeah, that's a good way to do it. And this will be a lot of fun. By the way, make it fun. This will be a fun trip for the two of you.
Yeah, I think so. Okay, great.
Okay. Well, thank you so much.
Yeah.
Son, you had a question?
I do.
Okay.
So when you practice the future present self, so you set a goal of like, okay, in 3 months, or like tomorrow, or like in 6 months, whatever the time frame you set, I am here now, but I'm in the future. So you bring the future back to the present. So the duration of the time, like, there's how do you set the time? Is there something?
Okay, another very important question. You go to the future whenever you want to, but the implementation doesn't have to follow the future that you created. Meaning that if you said, okay, 6 months, I'm up in the future 6 months, it doesn't mean that in 6 months you have to get rid of it. You let the innate intelligence work with you. So you don't have to.
So whether it's 3 months or 6 months, you set the time that sounds good to you. What the best?
Yeah, I could say a year from now, whatever you want, and then you let the innate intelligence work with you, and it'll be faster than you think. But if you set a limit, then you're already constrained to, it's not getting there. Just like Dr. Northrup was talking about, that you're trying to work on the biofeedback and it distracts you. Mm-hmm. Setting the time will distract you. You only go to the future in whatever you want, and then come back and let the innate intelligence guide you through a faster tunnel than the biology that says, well, if you got this illness, it's going to take you this time to heal. That's on the average, and not using the techniques that we're talking about. So that's really important. So you see, questions really clarify a lot, and it gives an opportunity to consider things that maybe you haven't even thought about. Who else? Anybody else? Was it Jeff? He's muted now, right? Yeah. Jeff, you had a question? Okay, yeah, all right, good. You can text it. Yeah, you're getting the echo. I don't know if it's because of your phone or whatever. But the other thing that I wanted to talk about is that there are three things that are the challenges. Three things that are the challenges, okay? One is that when you're trying to make any change, you're gonna need three things when you're trying to make any change. You're gonna need patience, you're gonna need courage, and you're gonna need faith. And by faith, I mean believe in an outcome, not religious faith or anything like that. So any challenge, you have patience, courage, and faith. And look at it in terms of terrains. Each of them has a terrain that allows it to happen, okay? So let's say that you're working on a goal, future, present, and you're finding that it's just not happening as fast as you want it to happen, okay? So then what do you think you need there? Patience, right? So what is the terrain for patience? What is the terrain that allows patience to grow? Becoming aware that you're in the future, that you're in the urgent present. And some of you already know about this because I've talked about it before, but what is the mantra for getting out of the urgent present? Don Quixote, dress me slowly, I'm in a hurry. Immediately you have to slow down what you're doing. Dress me slowly, I'm in a hurry. That's what he said to Sancho Panza, who was helping him with his armor. It was attributed to Napoleon, but way before Napoleon, he said that. Reply regarding time anticipation? How do you mean it, Jeff? Let's see. I don't see it. Okay, I'll text you today. Anticipation reminds me of your idea of celebrating FIFA. Oh yeah, okay. Yes, Jeff said that the working in the future present time anticipation reminds me of the celebrating the feed forward. That's a technique that I use a lot. Feedback is information from the past to use in the present, like whether it's biological or whatever, things that are happening to use it. Feed forward is a word that I had to invent in order, which is going into a particular situation that, and it goes very well, you're right, it goes very well with the future present. It means that you're doing something in the present that has the potential to be expressed in the future, and you celebrate it in the present, and then find out later what it is that you celebrated. That's another way of getting in the future present, but that's another way of looking at. So for example, you say today, by the way, I'm gonna do this tonight. I'm taking myself out to dinner tonight to celebrate something that I don't know. So what happens is that when you're setting yourself up to, number one, celebrate something that you don't know, which is feed forward. And then when it happens, you say, so this is what I'm celebrating. And what will happen is you're creating a synchronicity, an awareness, a selective perception to make you aware of the good things that are going on that you already celebrated, and then you celebrate it again when you figure it out. So that's the technique of future present. I mean, of feed forward. Um, and you can create any, you can do it anytime. In the present, this is the opposite of going to the future. In the present, I'm creating a future possibility that's going to be unfolding for me, but I've already celebrated it. And then when it unfolds, I'll celebrate it again. So you see, you're making your life very rich by doing that. Okay, so the three terrains of the challenge. So you find that one is patience. If things are not working fast enough that you're wanting from the future present, that immediately says, I am living in the urgent present. So dress me slowly, I'm in a hurry is the mantra for the day. And you begin to, not only about that, but everything, slow everything down, slow everything down. That will create the terrain for patience. And practice it. It's so simple and yet so powerful. I do it all the time because, you know, things are not going to work the way you want it. They're challenges. That's for patience. And if you have any questions later, I'll try to clarify it more. The next one is courage. Courage, you're going to learn it in a way that I don't think you've heard it anywhere. What is a terrain for courage? It's not being strong. It's not the opposite of cowardness. Courage is built in a terrain of self-valuation. You cannot have courage for anything that doesn't have value. So if you, a piece of paper that's not that important falls in the water, forget it. But if a diamond ring falls in the water or your child falls in the water, the value of that will make you courageous to jump in the water. Value is important. How do you create the terrain of value? The self-valuation goes up when you maintain self-caring commitments. So when you don't have courage, you're afraid, you're saying, I'm so afraid of doing this. I'm so afraid of going on and following up on the things that I really should be. Immediately you say, okay, I have to create a terrain of courage, which is self-valuation. How do I bring my self-valuation up? For that day, you keep and create self-caring commitments. Self-valuation goes up. And if you're valuable enough, you'll be courageous to continue on the journey. So you see, it's counterintuitive, but it works. And the third, faith, is when you kind of lost hope, and we all do on our task. You lost hope, so then what is the terrain for faith? The terrain for faith is to function without evidence and to function without expectation for outcome, for the thing in itself, and the existential thing in itself. I'm going to do it. I don't care what happens. I'm going to do it. I'm not looking at evidence. I'm not looking at how it's going to come out. I'm going to do it Spartan. I'm going to go with it. And then you might need a little courage. So you go to the self-evaluation. They kind of work together. But that's how you build the terrain of faith. And what you do gradually when you do it, then the faith begins to come back. The patience begins to come back. And the courage begins to come back. And the next thing you do to enhance it is to do a meditation and ask yourself, when was the last time that faith, that evidence without faith worked for me? When was the last time that I was patient and I got out of the future of the urgent present and it worked for me? And when was the last time that I did what I'm trying to do now and it worked for me? Any one of the three: faith, patience, or courage. For example, one of the things with patience, it would be like somebody writes you a dirty email, they're angry with you, and you say, acting in the urgent presence for me to respond right away. Okay, I'm going to put it off. I'm going to respond tomorrow and see what happens. And you notice how happy you feel that you didn't respond right away. That's getting out of the urgent present. It worked for me that way. So there I have evidence. So it's always evidence-based. The brain needs evidence for it to be able to make changes like that. Okay, so any questions right now to continue to reinforce this concept of the terrains? And you always want to create a terrain for what's missing. It's the idea of bioinformation. Whatever's missing, that's a terrain you create. Okay, so what brilliant questions are you going to have? In what we cover so far, is there anything in particular that that is not clear to you? Yes.
I, what if, since the brain is picking up the cue from already exist, what's archived through the history, can we play this future present self with, what if we change the physical environment a little bit? Like, would that work better if there's like some?
Yeah, the physical environment will work better because remember, the context, the physical environment has a perceptual history.
Yeah.
If I'm in the bedroom, I feel good. If I go to the bathroom, I feel bad. That's there. So why would you want, it's like the example that I always use is someone's trying to give up cocaine and they're working in a cocaine lab. Not very good, very hard to do. You have to get out of the cocaine lab to be able to change the behavior. Same thing with this. You want to add movement and you want to change the context. So in the future present, you do it in a new environment, completely new environment, and with movement. You're walking around or you're doing this, you're doing that, because as you add movement to new context, you're adding the possibility of the neural maps to grow faster.
Would you give me an example?
Okay, so if you're trying to work on something, and in the old play, the worst that happens is when you're at work during lunch, you have a contextual history there that at work, what happens when you have lunch? You have to feel bad. If you don't remember, your body will remind you, say, hey, wait a minute, remember, you got to feel bad here. And you start feeling bad. Then when you do the future present, you don't do it while you're having lunch. You do it in a new environment. When I get home and I sit at my favorite chair, whatever, then that's when I'm making the changes.
Okay.
Okay. So that's important. You got to have a new context.
Okay.
Because if you go to a new context, the brain goes, what? What's this? And when you say, what's this? It pays a lot of attention to what's this. So
you're practicing the future present self before that event might come, if there's a pattern that happens at a certain place or certain time. That
identify pattern and context.
Okay.
Does this happen once a year? Does it happen every week? And does it happen every week in a particular context? And you're going to find that it happens more in one context than another.
Okay.
So always look for patterns and look for context. Ellen Langer has done a lot of work with that, with context and how it affects. She's found that it affects the level of glucose that you're having when you, the insulin, with situations with diabetes, cancer, chronic pain, contextual, aging, contextual.
Okay, thanks.
So a lot of it has to do with that. And so now that you know that the brain needs that, the brain needs context and it needs movement, you do the future present in a new context with some kind of movement, but look for patterns. Where do I feel this the most? Chris, I had an idea for Ron. He can do a pattern where he can begin to say, where do I feel the most unable to move? In what context? And what is the pattern? And then when he does the future present, he does it in a totally different context, with you in a different context. So to maximize the proprioceptive learning by doing that.
Right. And the thing is this, because Ron's a scientist.
Of course.
And there are, probably all these biological reasons. But what you're saying, in my experience, would be, it doesn't matter. None of that matters, because what we call the biology of this is all, it's all from cultural editors.
Yes, and it has a speed. The biology has a speed. If you're an immunologist, for example, sometimes have a real hard time with that because no, look, it's going to take this time. This healing is going to take this. Got inflammation. It's got the cells that are going to the
Right.
tunnel. The culture has a speed, and all of a sudden you find that there's a spontaneous remission or it healed half the time. It goes against the conventional learning that we have as quote scientists. But science is a culture, and science has a speed.
Right. Okay. So
biology of balance.
No. Okay. So Ron's got big problems with balance, not vertigo. Balance.
Balance. Okay.
Literally, will lose his balance and start to fall backward just all of a sudden. And and he's had every test known to humanity, and everything is normal except for one little vestibular thing. Anyway, how would you work with balance?
Okay, several things. One of the things that you and he needs to do it with your help, with what you're doing with one foot that you teach, actually, that helps occipital stability, as well
Right.
as you know. With what I'm talking about is something that Dr. Northrup talks about, especially for the gait, the wide gaits of people getting old. That's really powerful. Getting old, and you know, in the old way. You close your eyes and you lift one foot with your eyes closed and see how long you can stay. Uh, and you can't very much because you don't have that proprioceptive learning. That's one thing. But the other thing would be, and this goes a little bit against the concrete biology. In what other areas do I feel out of balance in my life? That's biosymbolic.
Yeah.
In what other areas do I feel in when I'm out of balance in my life? How do I respond? And second, who taught me to be out of balance? Which culture editor taught me out of balance? Taught me that out of balance needs to be punished, or that it needs to be something that. And what does being balanced mean? Being balanced means that you maybe have to never get angry, or whatever it is. Looking at the culture editors, and there's some learning there. There's some learning there. I remember that my mother told me that my grandfather was very successful when I was a little kid, and that he made millions and he lost millions. And said, okay, good. So I don't want to be like my grandfather's. So when I got to a point where I was making the most money, bankruptcy.
What do you?
No, the balance issue is, the question is good, but my life has always been lived on balance.
Yeah, Ron
I've always
says
had a balanced life. I balanced everything.
he balanced
Exercise,
everything. His whole life
food.
was on balance.
I-
Balanced food,
consciously-
balanced exercise, consciously balancing everything.
That's why I always
Okay,
had
so
a
then, and I'm gonna go way out here with a biologist, but then, proprioceptively, the only way that he can get out of balance is like this. That can break away from the model. Hey, I'm gonna be out of balance. I'll show you. You want me to be balanced? I'll show you.
Yeah.
That's a bioinformational seed there to fit in.
Yeah, we don't know. Yeah, but that's a koan, that's like a little thing to meditate
That's
on.
right. That's right. And what could happen, another thing to practice it, that I've done it with my things too, is that to practice being a little bit out of balance and other things that he has to be in balance, not just with body, but I'm gonna start living an out of balance existence, which means that out of balance has a punitive attribution. Out of balance could mean irresponsible. It could mean whatever. Someone taught him that.
Mm-hmm. Okay.
And then you have to defy the culture editors. And if he starts being out of balance, is he besting somebody who forced him to be in balance? Or is he imitating somebody that he doesn't want to imitate anymore because he wants to individuate? Those are things that go really well with the bioinformational field.
Okay.
In our biology, we don't learn that in our biology.
No.
I'll give you an example. This woman was with a man who was a vampire, and she was having anemia. She had anemia.
Well then.
and then she gets rid of the guy, dumps him. 6 weeks later, no anemia.
Yeah.
And I think one of the ways to explain it in a kind of a new biology is that we are a hologram, and our biology goes to the hologram. One example of that, phantom limb. Why would you have a scratch? Why would you itch in a hand that you no longer have? Because
Right.
the brain creates hologram type of bioinformation, and it follows. So that's a drastic example, but it also does it on everything else, on balance, on this, on that. And then if you defy that conventional biology and you begin to sensitize yourself in the areas where, if I'm out of balance here, it's okay. I'm out of balance with the money a little bit here. I'm out of balance with that. I'm out of balance with that. Then you don't have to use the extreme to actually defy being out of balance.
Yeah.
Especially when they can't find anything. They find a little thing. When they can't find anything, I think it's wonderful because that's when bioinformation works the best.
I agree with you. No, it's way better if you don't get a diagnosis. That's
Absolutely.
been my experience. Yeah.
And you know, and medicine, as you know, in psychology, we get very anxious when we can't peg somebody.
Yep.
The moment that you can give them a diagnosis, okay, now, well, that's what it is.
What it is, and this is the course of it, and this is what you can
That's
expect.
right.
And
Like
then, and then you're sunk. Then
that's
you're in
it, so you're
shape.
in.
Yeah.
And the one that I told, this friend of mine that told you, he's a physician, he's 75, and his right knee was hurting. So he goes to the doctor, a friend of his who knows he's 75, and he says, so what do you want for your age? He says, I want the same thing that my left knee has that's also 75.
That's right. That's right.
So that's what you begin to defy. And George Solomon went through hell because he, you know, what is it? Number one, you're a psychiatrist. What do you know about immunology? Well, he knew more immunology than the immunologist, but you're going to have those cultural editors bring you back into that reality.
I know.
That is a collective reality, and you can't come out. You're not allowed to come out.
Right. Okay.
So those are things that you know, try them and let me know, because I think there's a lot there that's going to happen that's going to be really good, especially because you believe in it and you're helping him move into it. But at first, do it without any evidence. You don't need any evidence. This is crazy. I'm going to do it anyway, but I don't need any evidence that to be shown here. And I mean, I can give you some examples of some of the evidence, kind of heuristic and kind of extrapolating, but it doesn't matter. Just try it and see what happens.
Sounds good. Great.
Yeah, great. Thank you so much.
All right. Thank you.
Anything else? Hey, we got 2 hours. Yes.
Terry, I unmuted you.
Okay. Hi, Dr. Martinez.
Hey, how are you, Terry?
I'm well. Is there a recommended number of times that you suggest we do this? And if so, is there a better time of day that's more effective? Or does it matter?
That's a great question. You do it, what you want to do with all of this, it's very individual. So you want to really test out your system to see how much you need. Your body will say, okay, I've done it too much. I'll do it tomorrow. Number one. And number two, always do it in a context that's pristine, not in a context that you feel the worst. Even when you go to the future present, the actual present that you're in, the physical present, do it in a new place. So that even that, when you're coming back to you don't have so much noise. Because let's say that your pain is in the bathroom. You don't want to do it, the future present in the bathroom. You do it outside or whatever. So when you come back, you're already in a new context that the brain doesn't know what to do with. So you're feeding it all kinds of information that makes it easier for you to implement. So that's a really a good question.
Okay, good to know. Thanks.
Yeah, thank you. Okay, now, before we end, I want to make sure that everyone believes here that you're beautiful, brilliant, and extremely healthy. Now, the vampire said, oh, that's not true. I don't feel right. Believe it if it's happening. And it's not that it's going to magically happening. You're creating a framework that gets you out of the tunnel of helplessness. And it allows you then to integrate new information, to give a new attribution, but remembering that you have 3 things. You have to have patience, courage, and faith. And you know the 3 terrains now to build it. And it's a process of having a lot of fun. Where did I learn a lot of these kinds of resilience? I used to be an irresponsible surfer in Miami. And my teacher was a PhD clinical psychologist, a neuropsychologist in a wheelchair with muscular dystrophy. So he would always have plan B. What do you mean plan B? Well, if this door's not wide enough, then plan B. Which way are we going? What's the matter with you? And one day, I came in late, and I said, Bob, you know, I'm sorry, I'm late. I don't give a damn. I'm a cripple. I said, I'm not disabled. I'm a cripple, and I'm here. So next time you're not here on time, you're out. And I thought, Jesus Christ, what an insensitive man. But since I wanted to work with him, I had to learn to be responsible, be punctual. So my resilience came from this guy with muscular dystrophy, who had more resilience than I did. Okay, so then next Saturday, if you all can make it, it'll be great. And if you don't, then Wendy's going to send you the video for this. But thank you so much. And Chris, thank you. It's an honor to have you here. You did a beautiful explanation. It's so wonderful. Read her book, please. Her latest book, just outstanding. If you haven't read it yet. So thank you so much. And I'll see you then next week. Thank you all. Bye-bye. Enjoy.